Why does it say that?
It's because I sent you the link.
Mayor, everyone, shh. We're getting ready to go live. The mayor's counting down 20 seconds.
Why does it say that?
It's because I sent you the link.
Mayor, everyone, shh. We're getting ready to go live. The mayor's counting down 20 seconds.
Why does it say that?
It's because I sent you the link.
Mayor, everyone, shh. We're getting ready to go live.
Good evening, Berkeley. I'm your Mayor, Jesse Adeguin, and thank you for joining us for this virtual town hall on the City of Berkeley's response to the COVID-19 pandemic. It has been several weeks since our last town hall at the beginning of the month, and a lot has happened in Berkeley and throughout our country. We have a new federal administration, which has made prioritizing the deployment of the COVID vaccine a top priority. And I know we have a lot of questions around our vaccination program, which we will get to in our presentation and in answering your questions. I know that this is an issue that most of Berkeley is very interested in finding out more about and how you can access a vaccine. And it is one of the main priorities of the city of Berkeley as a public health jurisdiction to help to ensure that those individuals that are able to get vaccinated, that we are increasing the capacity to vaccinate them. In addition, and I'm sure this is something that Dr. Hernandez will touch on, while we have gotten through the holiday surge, the threat of COVID is still real. With the confirmation of several COVID variants that are now in the Bay Area, which are reported to be more contagious. And so I'm sure Dr. Hernandez will touch upon this in her presentation. I know a lot of Berkeley residents have been asking, what do these variants mean in terms of transmission? And also, do we need to change some of our behavior? Is outdoor dining safe, for example, with the wave of these variants out there? And how should we be prepared for the threat of these more transmissible variants? And in addition, sadly, we are seeing continuing people who have contracted COVID-19 and who are dying nationally. So while the deployment of a vaccine is definitely happening, and we'll be ramping up, the threat of COVID it still exists. And we also learned this weekend of a wave of infections of UC Berkeley students living in campus housing and in congregate living situations. So we really want to encourage the Berkeley community, particularly with a vaccine now being distributed and in the coming weeks and months, more people accessing vaccine, that we need to continue to stay vigilant and to practice the social distancing measures and the other public health measures that we have been following for the last year. And in addition, to take very critical precautions given the prevalence of these variants in the Bay Area. So with that cautionary note, that we start our discussion today. I know we've also gotten a lot of questions around the Berkeley Unified School District and their timeline and plans for reopening. And I'm sure we'll also address this in our discussion this evening. I want to thank the many Berkeley residents who sent us questions. We will get to your questions shortly, but I wanted to open our town hall today to turn the floor over to Dr. Lisa Hernandez, our public health officer, to provide any opening comments to the Berkeley community. If you can update us on the number of cases in Berkeley and any relevant data. I know that we're now not under the state stay-at-home order, but back under our local public health order. We're in the purple tier still. And I just want to take this opportunity to thank you particularly for your tremendous leadership over the past year and your tireless work to try to protect our community during this public health emergency.
Well, thank you, Mr. Mayor. And I guess this is a perfect time to thank you and thank City of Berkeley leadership for all the support that we have had in this response. So I really want to appreciate you and appreciate the city for really adhering to the guidelines and recommendations from not only myself, but my colleagues in the state and in the federal public health agencies. I will confess I'm battling Wi-Fi with my daughter. So if I get knocked off or slow down, my apologies in advance. So let's start though with the numbers as usual. For Alameda County, we are now at, this is not including City of Berkeley numbers. Cases are 71,406 confirmed cases of COVID-19 with 955 deaths. I will talk about case rate very briefly. This is the case rate and the test positivity are the two indicators the state uses for determining what tiers we're in. And currently, and this gets updated every week. Tomorrow we expect to see new numbers, but as of last week on the 26th, our case rate for the county is at 28.9 cases per 100,000 per day. And our test positivity is at 7.2%. That puts us in the purple tiers you mentioned, Mr. Mayor, because we used a higher number, which is the case rate. It puts us in purple. Our test positivity, I believe, puts us in red, but we stay in purple. But the case rate, I expect it to drop as we are seeing cases dropping. We peaked in the county in December for both the cases as well as hospitalizations, which I'll talk about now. We're currently hospitalized, and this includes City of Berkeley hospitalizations as well, at 318 people currently hospitalized. That peaked on the 31st of December. And ICU, we're currently at 97 individuals in the intensive care unit, also including City of Berkeley residents as well. And that peaked also in December at 124 individuals in the ICU. So we are seeing drops in cases, drops in hospitalizations, and in ICU for the county. And those numbers will be reflected in our case rates as we see moving forward. For City of Berkeley, our cases are now at 2,681 confirmed cases of COVID-19. We're averaging about 22 cases per day. Again, our numbers peaked in late December as well for our cases. We are now, I know Dr. Vargas will talk a bit about our dashboard, but we are now reporting on hospitalizations. We're just giving cumulative, so total since the pandemic, we have had 97 individuals hospitalized. In terms of deaths, we have 27, which also is an increase. And again, when we see increased cases, we see increased hospitalizations, and then we do see, unfortunately, increased deaths. So now we're at 27 deaths. Our testing has been doing well and continues to be about 900 tests per day. We've totally tested 197,000 tests on City of Berkeley residents since the beginning of the pandemic. And as I mentioned, about 900 tests per day with a percent positive at 1.3%. We calculate our case rate and our test positivity, and it's unfortunately not calculated by the county, by the state, but we like to see how we're doing in relation to not only the county, but the rest of the state in terms of our case rate and test positivity. And we're at 22 cases per 100,000 per day and a test positivity at 2.1%. Again, the state uses the county numbers, but we want to see how we're doing. So we calculate that ourselves. I want to talk a little bit about the variant. As we know, there's new variants circulating. There are about 4 notable ones that you're hearing about in the news and that we're also tracking. There's a UK variant, the Brazilian variant, the South African variant, and now there's a California variant as well. So those are 4. What we know is with the UK and the South African and Brazilian variants, they seem to be more contagious, but they are not causing more severe disease. So we may see more people getting COVID because of the fact that it's more contagious, but fortunately, we're not seeing that more people are going to be, there'll be more people unfortunately hospitalized, but they're not going to be with more significant disease because the disease is acting the same way once you get it. The California variant is very new and we're learning more and more about it. So right now, what we do know are 2 important things. What advice I give to everyone is still continue doing what you're doing and do it more often if you can. Washing your hands, staying home when you're sick, physically distancing, and wearing those face coverings. When it comes to vaccination, the vaccine, what we know in some of the variants, it may reduce the effectiveness, meaning that you might still get COVID, but we know for sure, and we're still learning about that, but what we know for sure is that it's reducing the severity of the disease and definitely reducing death. So people that have been tested, what we know is that they have not, has not, and have been vaccinated, but get COVID are not dying more and they are not getting sicker. So the vaccine is still effective in terms of preventing the 2 biggest things that we worry about with COVID. One is getting severe illness and the second is death. So I just wanted to mention that. The other things, as you mentioned, we did update our health order on the 25th to reflect the fact that we were removed from the stay-at-home order because of the ICU capacity. Basically our order mirrors the state's orders. And we have a couple of revisions, 2 modifications. One is that for retail capacity, hired shoppers. So those are the folks that are hired by individuals to do shopping for them, whether it be Instacart or Amazon or others. Those folks are to be considered as shoppers and in the capacity of the occupancy of the shopping, not as workers. So that's a little different from the state. The second one is not a new difference. It's actually the allowance of live performances without audiences. That's something we've had for months, but we have a little more detailed guidance. And so we wanted to make sure we kept those guidances for our community. It doesn't change the ability to have those performances without audiences, but it does provide just more guidance and feedback. The other thing with the stay-at-home order or shelter-in-place order is that that is different is that once we're in the purple tier and we're at a case rate of 25 cases per 100,000 for per day for 5 days, schools that have not opened can open. So that's something that we are looking at. And what we use again is the case rate of the county. So we have, as I reported, a case rate of 22 cases per 100,000 per day, but we have to look at Alameda counties. And I believe that we'll be in below that 25 cases per 100,000 per day very soon. And then we have to count the days for 5 days. So schools should be already planning to provide their safety plans to us and to the state. And there are additional revisions in the state's guidelines that they must adhere to. We know that there are 12 schools currently open and they have all had to modify their learning environments. And we know that that's what we have, we expect other schools to do. We continue to support the schools with training and technical assistance, and we do site visits with them as well once they've opened. So we will continue to do all of those things and provide the support to the schools so they can open if they can and want to. I will now hand it over to Dr. Varhus, who will talk a little bit more about some of our response efforts.
Thank you.
Good evening, everybody. Good evening, Mayor, colleagues, community. I'm happy to be here again tonight. I'll just update on three things. First of all, the city has just recently published a new interactive dashboard on our website. So people who really want to follow case rates and understand what's been happening essentially over the last 11 months can really get in there and really look at the data. So I want to encourage people to go to that site. We will be working to add vaccine relevant data to that site in the coming weeks. Our primary effort with vaccine, however, is to get the vaccine into people's arms. And so just a general announcement, because I know there are several questions about this. We really want to clarify that the vaccine remains a scarce resource. And we are doing our absolute best to manage it, to provide it equitably across our community as we get vaccine in a trickle at a time. We will say more about this in answer to the questions, but there is a lot of pressure from a variety of groups, age, industries, and lots of good reasons why people should have it first, second, or third, and lots of different perspectives on that. And the reason why it's such a battle in conversations is because we don't have enough. It's not because everybody isn't important. Families are important, kids are important, food industry people are important, older adults are important. And so we will be just continuing to get it out as equitably as possible as we get more in. And this is also a critical time. This is probably one of the most, we were on a state call today. This is probably one of the most difficult times of the entire emergency operation, because now not only do we have cases to manage and behaviors to change, but we have a new tool that we want to get out that is part of the entire disease containment response. Vaccine is really just a tool alongside all of the others, the mask wearing, the physical distancing, the hand washing. It's an important tool, and we need to, implement it effectively and quickly, but it's just one, and it is still one of those other measures. And then finally, I just want to add, our testing capacity continues to be excellent. So people who are concerned, if they are concerned, can get appointments currently fairly quickly. We continue to have both the YAP sites and the curative sites, which we have been looking at scientifically, and we'll continue to host it until we get any different information. But we believe in those efforts, and we have now since also included the Optum site bus that works on a variety of schedules 3 days a week. You can go to the website to find out where you can get a test. I'm learning that it's now at this point pretty easy to get an appointment and get a test, and results are coming fairly quickly. So we feel like we worked really hard to get that system up and running as effective as possible, and better, I would say, than most places. And we believe we will also be able to manage that same level of rigor with the vaccine distribution as more vaccine becomes available.
Thank you so much, Dr. Varhus. Thank you for that update, and thank you, Dr. Hernandez. I'm going to now turn to our acting city manager, Paul Budenhagen, to ask if the city manager's office has an update with the Berkeley community on city operations and our pandemic response.
Thank you, Mr. Mayor, for the opportunity to be here. Good afternoon, good evening to you and everybody who's listening and colleagues. The city continues to push forward with the work of the city, albeit with a lot of staff assigned to the pandemic response to help keep our testing and vaccinating and all the other work that's happening moving forward. So we're very proud to have made this transition to much of an online presence for folks while keeping city services going in the midst of this pandemic. And if I could, I'd like to, I know this is one of the questions, but if I could just kick off this work that the city's done to support some of the businesses. So very much appreciate Drs. Hernandez and Dr. Varhus and all of our work on the disease containment side of this. And as we get into the purple tier and progress along and start to do more work on safely reopening, I want to highlight a little bit the work of our Office of Economic Development that has really been a big support to businesses in the community, one of the questions asked about supporting restaurants and businesses utilizing outdoor space. And want to really point, if you're a small business owner or you work at a business, we have a page set up on the city website at cityofberkeley.info/COVID-19-COVID-outdoor/#parklets. I know that was a mouthful, but you can Google it and you'll find it. And we have a big outdoor commerce guide that really lays out everything someone would need to know to set that up and get that going. And then also, we've recently, in partnership with the North Shattuck Association, launched an outdoor commerce grant program, and really want to direct folks to the website so that they can apply for that if they're interested. It's at www.northshattockassociation.org/commerce-grant. And on that website, you'll see that businesses who are interested in partnering with the city and who have a valid business license can apply for one of these grants. The maximum annual grant is $800 for an individual outdoor commerce applicant and $1,600 for a group one. We're requesting that people submit those applications by 5 p.m. on February 28th, and all the information is up on the website. So we're very much looking forward to getting that grant program out and providing some aid and starting to see things open up more than they are safely. So thank you for that, Mr. Mayor.
Okay, thank you very much, Mr. Budenhagen. So with those updates, we now want to turn to your questions, and we've received a number of questions from Berkeley residents over the past week, the vast majority of which relate to vaccinations. And so we look forward to addressing specific questions around our vaccine rollout. And so the first set of questions I'd like to direct to the city manager's office. But perhaps either Dr. Varhus or Dr. Hernandez can elaborate on this as well. This question notes that Cal had hit its highest case peak this week, 137 cases and counting. The university says it intends to open up in-person instruction in the fall. Does the city have any concerns regarding Cal's cases that could spread to the general city, and what is being done to prevent this? I know that there was reported this weekend that there was a spike in cases, particularly students living in congregate living situations, and this has been an ongoing concern, certainly. But anything that you, Mr. Budenhagen or Dr. Hernandez would like to add on this?
I'll take it.
Yeah, Dr. Hernandez, take this one. Thanks. Yeah, go ahead.
Ready. So basically, we, as I've reported before, and this still continues, so I want to remind people that we work very, very closely with UC Berkeley, especially the Tang Center, which is the medical center for the health center for the university. And they have a dashboard, as I think this person who submitted the question probably has seen, which tracks their cases and their testing. And we too look at that. We also work with them one-on-one. And have been working with them specifically about these cases. Some of these cases we know are probably a residual or due to the fact that people came back to campus in mid-January and were either asymptomatic or were incubating disease. And then they were diagnosed because Cal has tested, which they do for all students. Anyone, whether they're on campus or off, can get tested. And there's required testing for those on campus for twice weekly. So they do find cases very quickly because of the enhanced testing that is happening for both people who are symptomatic or asymptomatic. So it doesn't matter. You don't have to just have symptoms to get tested. So we did notice that increase. We're working with them to make sure that not only are the cases isolated and the contacts are quarantined, but seeing if there are any other factors beyond some of the typical expectations of, say, congregate parties or gatherings and just being back in a congregate setting. So we're working with them and providing guidance and information to them and ensuring that they're adhering to them.
Thank you very much. I know that's sort of timely question, given the news that was reported regarding an outbreak UC Berkeley students. Next question is around mental health support for kids who've been impacted due to the lack of in-person instruction and socialization. I know this is a concern we all share. This resident specifically asking what the mental health division is doing around providing mental health support for kids who've been impacted during this pandemic, particularly due to the lack of in-person instruction and socialization with peers.
I'll take that question, Mr. Mayor. Thank you. I totally understand the context of the question. Kids have been, it is very difficult to be a child and a family member and a parent in these times. And I first want to send out that this is a very real situation we're all in, and we need to think about our kids, and we need to think about how we can provide them with the best mental health, developmental, and academic supports overall. So with regards to the Berkeley Mental Health Division, the Mental Health Division in itself did transform very quickly to providing telehealth services to their clients at the time that we went into shelter in place. So we have done everything in our power to both reach out to our children and families, both telephonically and via telehealth services. And we are also in the process of implementing a new app that can help strengthen the supports of our clients. That said, I suspect that the question was more related to what are we doing as a community to support our children when they can't go to school? The question is asked from a perspective of, if we don't have school full time, then we don't have anything for our kids. So first off, as Dr. Hernandez suggested, our disease numbers are at a point now where we can again begin to reopen schools. And we encourage and support all of our schools, public and private, to really be trying to make those moves as we go along. We have provided and continue to provide ongoing guidance and technical assistance and site visits, and as early as today, updated our school reopening guidance. And so we want to support that. We also understand that teachers and school staff are nervous and scared, and they want the best for the community and for kids. And so while we want to encourage and really believe that schools can and should open, and that it is meaningful and safe under the guidance, we also do want to express empathy for that population and understand that it is a challenge. And then thirdly, I just want to say that it's not all or nothing. It's not like if we just opened all the schools, kids' mental health would be fine. There's lots of things we can be doing as a community, as a city, as a district, as community agencies, as neighbors, as partners and friends, to really support and strengthen our kids. We've been reading about some hybrid instructional models where kids who really need to be with other kids for a shorter period of time can do that. We've seen examples of adults that are in part of kids' lives, visiting them or waving to them from outside, doing different things to make them feel warm, safe, and welcome. We really need to, A, focus on really helping schools to reopening, and B, be creative about how we're supporting our children and youth in our community, and really start to think outside of the box about how we can do that long term.
Thank you so very much. Mr. Budenhagen, it's a question around enforcement of individuals or groups of individuals not wearing face coverings in parks. This resident is asking, when is the city going to aggressively enforce mask wearing in parks, even putting up signs informing individuals that not wearing a face covering could result in citation, might be a deterrent?
We do have the ability to fine people if they're violating the health officer's order, and we have a regular enforcement meeting where we go through all of the community requests for enforcement or community notices of violation that people have sent to us, and we have staff who are, who are able to go out and work on that. We have code enforcement officers primarily, but we've also had staff from our Parks and Rec department who have gone through the parks regularly with masks and reminding people that they should be wearing their face coverings and complying with the health officer's orders. We haven't had those staff out there in the last month, and so appreciate this question and request for more enforcement in our parks. We are really trying to balance providing education and information to people and really encouraging people to comply, which the vast majority of people are doing, with heavier enforcement, which could include fines of people who consistently do not comply with the health officer's orders. So we appreciate the suggestion, and we're actually likely going to order some more signs. We've put hundreds of signs up in our parks reminding people of what the rules are. I was actually just biking through several of our parks this weekend and pleased to see that many of those signs are still there. And that is a suggestion we'll take under advisement about including on those signs that people could be fined if they are violating the health officer's order. So thank you for that question.
Thank you. You did address in your previous comments the efforts the city is taking to utilize outdoor space during winter months. If you are a business and you would like to get a permit for sidewalk seating or to convert parking adjacent to your business into a parklet, we have a streamlined permitting process. If you go to the cityofberkeley.info/COVID-19, there's information if you're a business about how you can access those resources. And then, as Mr. Buenhagen noted, City Council had allocated funding for a grant program to assist businesses in transitioning to outdoor activity. Particularly as we know, we're expecting rain any moment now, but particularly as we're entering, we're in the winter season, and we are going to be seeing less warm temperatures. So North Shattuck Association is administering the grant program, and if you need financial assistance to procure tents or barricades or whatever's needed to transition to outdoor dining, the City Council did make these resources available. I want to thank staff for working quickly to launch this grant program.
If I could just add really quickly, Mr. Mayor, if people have questions about that, we have economic development staff who are really quick to respond and are very happy to help, and they can email oedmailbox@cityofberkeley.info.
Thank you so much. So now I want to turn to some very health-specific questions related to vaccinations, and there was a question about COVID variants, and a question around health precautions. So the first question is, does the city have a protocol, or can the city develop a protocol for laundry facilities, including common laundry areas in apartment buildings? And as somebody who actually needs to use a laundromat, it's actually a very interesting question. I'm always very mindful of the, being indoors for extended periods of time increases your risk. So regardless of whatever sanitation protocols are in place, the more you're in a indoor location with other people, the more risk you bear. So is there industry-specific guidance from the state or from the city for laundry facilities?
There is actually. The state has guidance under limited services. So it's not specific for laundromat, but if you look under laundromat, it directs you to limited services. And they updated the guidance actually just last week. And there is specific guidance for laundry department. That would be something that the property manager could use as guidance, and the person can point the property manager to that guidance. And the second thing I would say is exactly what you alluded to is in terms of the risk individually that you take when you go to those settings. And what I would say is just use your gut. There are times when I've looked at a place and saying, I'm going to come back at a different time to do whatever it is that I have to do. So I think that's something that you have to always rely on, is your gut. And if you feel that it's unsafe because of crowding or other issues, someone's not wearing face coverings, that's what I would also rely on as well.
Thank you so very much. Dr. Inez, there are a number of very specific questions that we received around vaccinations. And so how should we proceed? There is some overlap in some of these questions, like people over the age of 65, for example, how do they access a vaccine? Are we prioritizing teachers, essential workers? So I guess what I may suggest is that I kind of group the questions, or maybe hit the high points, and we can kind of more globally address the questions, because some are very specific around people's individual circumstances and their eligibility or prioritization, if that works. Okay. So there are a number of questions of individuals that are in that are over the age of 65 or even over the age of 75, who have tried to get vaccinated through their hospital. They've been referred to their primary doctor, then they've been referred to Walgreens or CVS. In addition, there have been questions around, how do individuals, over 65 who may have pre-existing conditions, how do they know where to access a vaccine? There are a lot of questions around, where do I go? Some people who've tried to get information by contacting their healthcare provider and have not, have been directed to other places to get vaccinated, and some that just don't know where to go to get vaccinated. So kind of with that kind of high level overview, could you or Dr. Varghese just provide information around, for people over the age of 65 who are eligible to get vaccinated, what should they do? Where should they go? I know we have a website where people can sign up, where they can get notified. We're also encouraging people to sign up through their healthcare provider. A subsequent question I'll ask is sort of around equity in terms of how we are informing people and distributing that, our public health jurisdiction distributing vaccine. But I guess a good starting point would be about what should people do?
So I can start, and then Dr. Varghese, if you want to add. The first thing I would say, if you have a healthcare provider, well, first I'll say this: demand is definitely greater than supply. And I wish we weren't in this situation, but that's where we are. So I just want to acknowledge that these are tough times, and I'm looking forward to a time when we have them matched, demand and supply equal. We're not there at this time. That said, what I would say, if you do have a healthcare provider, that's your first stop. I would say they're the ones that the answer might not be satisfactory, and they say, we don't have it, please check with the health department. But first, I would say, first check with your provider. And then after that, then you can always, as you mentioned, sign up with our website to be notified about when. Right now, the city is just vaccinating. We're finishing up 1A, so we're finishing any 1A people in that phase that haven't been vaccinated, but primarily we're shifting to phase 1B for 75 plus. Other providers in our jurisdiction and in the region are at 65 plus. So that's why I also say, if you do have a medical provider, they might be able to accommodate you if you're under the age of 75. And we're adhering at this point to that. The state is providing guidance, and some of that is is evolving. So that might get modified, and then we'll have to see how our supply matches the changes. What we do know is that that in time we will all get covered. Whoever wants a vaccine will, but at this time, we're really trying to prioritize those that are most impacted and are those that might succumb to severe disease or death. But that might change as our supply opens up and as we get guidance from the state.
Okay, thank you. I'm going to go to some of these specific questions. How are we getting vaccines to seniors who over 75 who may not have access to a cell phone or computer?
I'll try to take that one, and anybody else. All three of us actually on the panel have been working very heavily on vaccines, so we all can chime in. I think that is, of course, a challenge. And so on the statewide call today, it was really emphasized that the state has three guiding principles that we should all be using: speed, simplicity, and equity. They don't necessarily match up. And we are very concerned about our senior citizens who may not be able to, click on a link that's sent to them in an email or might not have access to technology. And so we are working on strategies for trying to support those seniors. One of them is we have been increasingly looking at partners to help us distribute vaccine as quickly as possible. And we are looking at the possibility of finding a partner that has telephone capacity, call center capacity. The other option that we're looking at is being able to have some of our own disaster service workers perhaps be available to answer and address calls. And then we are also working through our Aging Services Division in our Health, Housing, and Community Services to be able to communicate with our senior center members, Meals on Wheels recipients, and other people who may conduct partnership with Aging Services. We're still working on this because the challenge is we have to deal with that very specific complex challenge while also getting the vaccine out. And so it's always going to be a balance between the equity and understanding that not everybody has access to technology and other ways of getting, or transportation or other things, and getting shots in people's arms that really protects everybody the more that we're able to do that. So those are the things that we are really balancing. Ultimately, as a local health jurisdiction, our primary responsibility is to members of our community who are most vulnerable. And ultimately, as we get more vaccine and the local and the healthcare providers are becoming more the primary distributors of vaccine, we will be much more in the business of our current expertise, which is really getting vaccine out to the most vulnerable people that need it.
Thank you so very much. There was a question around, this 87-year-old resident tried to sign up. This question didn't indicate whether they signed up through their healthcare provider or through the city, but tried to sign up to get an appointment scheduled to get vaccinated, and there were no available slots. So they were wondering if they should resubmit a COVID vaccine interest form. Or whether their information is been received and they will be informed when they can schedule an appointment for vaccination.
Yeah, so as part of our effort to get vaccine out as quickly as possible, we worked with a partner agency and provided some vaccine and information and names of people that had distributed that had filled out the form. And unfortunately, the link that was provided to Berkeley folks who were qualified was distributed to way too many people. And the result was that it ended up blocking appointments for those for whom we had intended them. That does not mean that vaccine wasn't well used. It was used for phase 1A healthcare workers in Berkeley and people over the age of 75 in Berkeley. But we did not get the people that were sent that information. Many of them were not able to make an appointment. Therefore, we have identified another solution that we will be sharing with those same people tomorrow that will provide an opportunity for them to get vaccine. So we will be in touch within the next 24 hours for a solution. So we actually, again, it's super scarce resource. People are super, people, if you're tech savvy, sometimes there's ways to beat the system.
Yeah.
I think we all know stories of a variety of ways that people have done that, in hospital settings and other settings. But we will actually be back in touch with these same people who really were not served well.
Yeah, I think one thing I really want to emphasize is at all levels, whether it's Berkeley Public Health Department, Kaiser, there is a scarcity of vaccine available. And that is really significantly impacted our ability to ramp up the number of people vaccinated. We want to vaccinate as many people as possible, but we need more doses. And so, it's encouraging their efforts in the federal level to get 200 million more doses. That will certainly help. There's other types of vaccines that are coming on the market, which will also help increase the capacity to get more people vaccinated. But I want people to understand the most critical challenge that we face right now to get as many people vaccinated is we don't have enough vaccine. That's not anything to do on the city of Berkeley's part. That's just there's a limited supply. So I really want people to understand that. And that doesn't mean we're not working to get more. It's just there's a limited capacity. There were some questions and some comments that we had received around. We had received additional doses. Have we used those? Do we have quote unquote doses sitting in the fridge? I know that we have had, we have been using every single dose that we possibly can. So maybe could you touch upon, our rollout, are we using our doses? How are we prioritizing the doses that we have? Because there is a perception just by looking at the dashboard, looking at the data, that we are not administering vaccine. And I think it's important to clarify that for the Berkeley community.
So every dose that we currently have has a plan tied to it very specifically. So currently we are administering a number of second doses that our original vaccine clinics had started providing back on December 28th. So we are currently in the process of that. In addition, we have 2 significant vaccination clinics planned for later this week, which there will be messaging about tomorrow and or Wednesday, where we will begin distribution of all of the vaccine, the remaining vaccine that we have on hand, as well as partnering with Alameda County with some additional vaccine resources that they have actually helped provide us with. So that information is coming, but what I can say is there's nothing, well, on the dashboard, it may look like people use the term sitting on vaccine. No, if you get 100 or 200 doses of vaccine and you have to plan a clinic, you have to pull it all together. You have to arrange the clinic. You have to manage cold storage. You have to manage transport. You have to make sure you have enough vaccinators. We have all of that rolling like a treadmill right now. And you're going to see big numbers later towards the end of this week and into next week that should help account for that. All of that vaccine is being used.
Thank you so very much. There were a lot of questions around various different types of essential workers and what are they being prioritized or why aren't they being prioritized? Teachers, grocery workers, people that work at Golden Gate Fields. I know that the tiers, that the prioritization the state has been implementing has kind of shifted a little bit. We were sort of focusing on certain essential workers, and then the state made the decision to prioritize people 75 and up, and then that number was adjusted to 65 and up, and now there's some discussion of between 50 and 65. So while we are a local public health jurisdiction, could you maybe talk about this balancing of, how do we prioritize different populations? What's guiding that decision making? And it's not necessarily a lack of consideration or concern for those particular types of essential workers, but that there's certain parameters that local health jurisdictions have to follow in how we deploy the vaccine. I will acknowledge that 1B, there are various elements within that. Teachers are included, university employees, other different, and so I imagine that we're looking, internally as to how are we going to prioritize people 75 and up and 65 and up, while also looking at these categories of essential workers as well.
So I can start with that. First, as you mentioned, Mr. Mayor, we do have to adhere to federal and state guidelines and their phases. And then within that, we as a jurisdiction have looked at a couple of criteria or values that we're adhering to, one of which is equity. The second is about risk in terms of your either it be age or health conditions or exposure. So we're looking at those criteria to determine within the structure of the state's phases how to give out vaccine that we have, as Dr. Varhus mentioned, scarce resource here for all of us in the nation, actually, or actually the world. So we're doing the best that we can with those guidelines. And again, if we got more vaccine, once we get more vaccine, we're going to give it out as soon as we can. But we do look at both risk, as I said, risk for having severe impacts of the disease, whether it's complications or death, as well as risk because of exposure, because you are working on the front lines, and then also an equity-based approach. So those are what we're looking at, but they're still tough decisions to make, even with those guiding principles to adhere to.
Thank you very much. I know that there were some specific requests amongst the questions and comments that we received to prioritize teachers and also childcare workers. So I wanted to call attention to that. I know that that's something that BOSD is talking with us about with respect to their plans to reopen. A couple of questions around our vaccination of seniors. This resident was asking a status of vaccination of nursing homes and assisted living centers. I know that we've been working on that for the past several weeks in partnership with I think it was CVS we were working with.
It's both CVS and Walgreens, and they've divided the facilities. They've all received their first doses, but they have 3 clinics planned per facility, and that is for both residents and for the workers. And the individuals that didn't get vaccinated the first time have 2 other opportunities to get vaccinated through whether it be Walgreens or CVS. So they've finished the first round at the facilities, and they're starting their second this month.
Thank you so very much. There was a question around outreach to senior apartment buildings. If that is sort of the senior services and senior apartment buildings as part of our kind of outreach campaign to let people over 75 know that the vaccine is available.
Yeah, so some of those facilities are actually part of the same pharmacy partnership program that the skilled nursing facilities are. So that's good news. We have a list of what those facilities are. And we do need to do outreach to the other facilities that aren't part of that process. And we will be leveraging some of the services of our aging services division to support that, again, with limited vaccine, and the speed issue, it may take a few more weeks than we would like, but we are definitely understand the need to do that outreach and if possible, begin to provide mobile clinics so that we can come to people where they're at, so we can perhaps hit a couple of locations at a time. So that we are in the planning process. We were very aware that we should be concerned about that situation, and we will be focusing on that in good time.
Thank you. A couple more specific questions, not vaccine related. This resident's asking, can you confirm that you're instituting the state level guidance by Naomi Burdock on school distancing in schools of 4 to 6 feet as practical public health guidance that allows us to open schools? I guess that there's specific guidance around physical distancing that that may enable school reopen. I know the CDC recently issued some guidance as well that sort of concluded that the public health risk was not as significant as originally concluded for in-person instruction in schools. And I would imagine this is something the state is actively considering, as there are state level discussions around reopening with teacher unions and with the legislature.
So Dr. Burdock is a physician from UCSF that actually is now working at the state and did provide guidance and restructuring of the state guidance. And she's also part of, and I can't remember the official name, but it's like the Safe Schools Committee that's headed by CDPH, but also has Cal OSHA and I believe Department of Education and a couple of other stakeholders. So she's definitely front and center, both as a leader in our region, but also at the state. And those guidance are the ones that we point to as well. One of the things that they talk about in terms of distancing is that there has to be strict distances between students and the teacher. And then there's the 4 to 6 for the students, though I recommend as much as possible. I was in a school today and the schools know that we're going to ask them to do as much as they can to do the 6 feet, because we know there's drift when it comes to the chairs and the desk, but we definitely are adhering to Dr. Bardock's recommendations as they are incorporated in the state's guidance.
Thank you so very much. An important question that I've been hearing is, finally, what additional precautions should be taken to prevent the spread of these variants that we discussed earlier in the town hall, and how dangerous are they?
Well, we're learning more and more about the variants as we go, but what we do know at this point is that while they seem to be more contagious, they're not increasing the severity of the disease or increasing deaths because the disease acts differently once someone gets infected. So what people need to do is to continue to do the same strategies that we've talked about already: wearing your face coverings, staying home when you're sick, washing your hands, and having that physical distancing. So that's more important than ever. Unfortunately, there's nothing magical at this point, but these are the recommendations that still are ones that fortunately are there to protect us and continue to protect us with this new variant.
So as sort of case rates are decreasing, and we're in the purple tier and maybe in the red tier at some point, and more business activity is occurring, and people are going indoors for limited business activity, or they're outdoors, is there a greater risk of doing that with these variants? Do we have any information to suggest that?
I think as long as people adhere to the guidances, even if you're vaccinated, you still have to wear your face mask. That's the other thing, is that we have 2 things going on. Well, 3 things. We're tired. we are also seeing variants that are behaving, seem to be more contagious, and some people are getting vaccinated. So they're all forces playing against each other here. And we have to rely on what we know, and what we know has worked, which are the guidances, again, wearing your face mask, staying home when you're sick, physically distancing, and washing your hands.
Okay. One last question on this variant issue, because I've gotten a lot of questions about this. It's been suggested that people, given the spread of these more contagious variants, should double mask, meaning to wear a KN95 or some sort of protective mask, and then to wear another mask on top of that so as to limit droplets or from being in the air or people inhaling droplets. Is that something that you recommend, or is that a good precaution for people to take?
I think it's a hard one, because what I want to make sure happens is that it fits. When you start layering mask on, it may not be an effective seal. So you want to ensure that you have that. So even if you have two masks on, if they're two poorly fitted masks on, then the effectiveness reduces. And I don't know, have you ever worn two masks? That's very hot and uncomfortable.
I did it today. It's not easy, but
yeah. So I think that that's something that look, we've got an example here. So if you can do it, I think if you can be, it can be effective, and it's something that's reasonable for you to do. It's something to consider, but it is tough to do, and also more importantly, you have to be effective, especially with the seal above your mouth and your right by your nose here. You really have to be sure that you're getting the seals all over. So that's the part that I would say, that it is being recommended in some places. There's also recommendations in Europe for wearing surgical mask. I think the best thing is that you have a mask that you use and a mask that you are sure that is properly fitted and that it's comfortable.
Thank you so very much for that guidance. A couple of questions that I'm going to take, both of them are around school reopening. Asking specifically what am I doing around ensuring that we can reopen our schools, acknowledging the inequities and impacts it's having on our kids, and specifically ensuring that schools can reopen as soon as the state benchmarks are met. As Dr. Hernandez had touched upon at the beginning of the town hall, we are currently at 28.9 cases per 100,000 residents in Alameda County. The benchmark is 25 cases per 100,000. And so we don't have a date yet, but hope is soon we'll reach that benchmark. Even though our data in Berkeley is lower than the counties, for state's purposes, we have to use the county's data. And so hopefully sometime very soon, we will be able to give the green light for school K through 6 to open. And that's K through 6. Middle and high schools, there are different metrics to meet. And so, to that end, as Dr. Hernandez said, I think it's important that Berkeley Unified, continue to plan and be prepared for reopening. As we know, there are a lot of different issues that the district has to grapple with as they're deciding to reopen. One of which is, they need to meet and confer with their teachers and other classified employees per state law regarding workplace conditions. And so those discussions are ongoing. I urge the district and BFT to reach a speedy resolution to those discussions, because families and kids are struggling and desperately want to go back to the classroom. I recognize that not every teacher will want to go back to the classroom, but the more we can begin to start phasing in-person instruction, the more I think it will help us address the learning loss and the equity issues that families and kids are experiencing in our community. From my perspective, and I think from the city's perspective, reopening our schools is a top priority. Right now, there is a legal barrier for that to happen, but the minute we are able to, it will happen. And I think we provided an incredible support to the district this entire time. Not only providing technical assistance and working with them in their development of their plans, supporting their efforts on testing. We developed learning cohorts that launched this fall that will be allowed to continue under the health order, as well as if district wants to move in that direction to reopen. And I know that there's been a lot of discussion around testing and vaccination of staff and of students, and those are things that the city will continue to discuss with the district. And we talked about some of the challenges in terms of vaccine availability and prioritization. I'll just state my own personal opinion is, we have to get through that 75 and up sort of tier right now, but I would hope that we can find a way to prioritize teachers as part of future testing that we're going to be rolling out as part of phase 1B. And so that's just something for us to discuss with the district. So where we're at now is they're not technically allowed to open, but hopefully, when we reach that benchmark, they will be allowed to. Our role is really to enable them to open legally per the order, and to provide support. And I think that's something that we will continue to do as we've done this entire time. And I really call on the district and I call on BFT to reach a resolution, and because our kids and our families are struggling. And the city is here to be a partner, but we want to be able to create a safe path for schools to reopen. The long-term learning loss impacts are going to be significant for families. And even before the pandemic, racial disparities in student achievement in Berkeley schools was significant, one of the largest in the state of California. And so, it's going to get even worse, after this year. So, there's a real sense of urgency, and I acknowledge it's not easy, and we got to center the safety of the students and the staff in these discussions. But we hope that, that a solution is on the horizon. So that's my answer to those questions. There was a question around economic recovery. What is the city doing to support small businesses? We've done a great deal over the past year, from launching the Berkeley Relief Fund, and we're still raising money for the Berkeley Relief Fund. Go to berkeleyrelieffund.org to please donate, so we can provide additional cash assistance. We partner with the county as part of their CARES Act grant program to double the amount of funding that's available to local businesses, and we are able to help a number of businesses in the city of Berkeley. We passed an eviction moratorium. So if you are a small business and are unable to pay your rent due to loss of income, you cannot be evicted during the state of emergency. We have adopted legislation to prevent rent gouging. So if your rent increases beyond by more than 10% during this pandemic, that is illegal under City Berkeley ordinance. And I think, Mr. Bunagan touched on this. I think our OED staff has really done a lot working with our business community to talk about the grants, the PPP assistance, and other resources that are available for small businesses. Going forward, we're going to have to talk about how we sustain that level of support. And because, the recovery is going to be challenging. But I don't know if Mr. Bunagan, anything you want to add about the small business work that we've done?
I think you've really covered it beautifully. We have really done a lot, and very proud of the work our economic development team has done and continues to do, and stands by ready to do more if there are businesses out there that are struggling or that want help, and they should just email our economic development folks, and we're ready to provide support.
Thank you. Yeah, I mean, it's heartbreaking that some of our really valued, treasured small businesses are not going to reopen. And small businesses are really the lifeblood of our local economy. And like many other communities, our restaurants and other small businesses are a significant portion of our tax base. So it's our priority to get our businesses through this crisis, and it's not just through economic support. We got to look at whether tax relief's appropriate. We have to look at what kinds of technical assistance we can provide, how we can help businesses access the state and federal resources that are available, which more is coming on the way through the state grant program, and now through the new CARES Act, and hopefully a third CARES Act that's under consideration in Congress right now. So, please contact cityberkeley.info/COVID-19 It's a list of a whole bunch of resources around things that the Berkeley is doing to support our small businesses, and we're here to help. Lastly, and I think this is a really important question that's been on my mind a lot, over the past few weeks, is equity. Equity in terms of how we are rolling out our vaccination program. And you heard us all say that equity is a really critical lens and focus of the work that Berkeley is doing. As a local public health jurisdiction, to make sure that people that are not able to access vaccine or those that are most at risk are prioritized in who we are vaccinating. And, Berkeley side published an article that recently and that talked about some of the statistics of who succumbed to COVID-19 in Berkeley. And not surprisingly, along the lines of what we've seen nationally, it's predominantly older individuals and older African Americans and Latinos, which is consistent with what we see nationally. And so, there's no question, as we've talked about in many different town halls, COVID has really, once again, shone a spotlight on the major racial and economic disparities that exist in our society. And lack of access to healthcare, and other social determinants that lead to underlying health conditions that put people at greater risk, which does exist even here in Berkeley. Even despite, our values and our progressive reputation, these disparities are real in our communities. So it is my highest priority, and I know it's the priority of all the leaders here on the call, that we are going to prioritize equity, removing language barriers, and making sure that we're focusing on outreach and vaccination of the people most at risk, which also includes our Black and Brown communities in Berkeley. And so I want to announce that my office is going to be leading sort of an outreach initiative, working with our staff to bring our faith leaders and service providers and others to get together so we can work in partnership to get information out to vulnerable communities, and to support the very focused equity work that our staff is doing in vaccinating people in our community. So deeply concerned, there are language barrier issues, or you don't have the time or the savviness to know how to access where to sign up, you're not going to get vaccinated. And so we are missing on the people that really need to get vaccinated, who are not able to access that critical information. And that is our responsibility as a local public health jurisdiction, as a government, to step in and to address the needs of those individuals. So I just wanted to address that is at the top of my mind, and I'm deeply concerned about that, as we all are, all the leaders here on this call. So those are all the questions. And I just want to close before I go to our panel of distinguished leaders that the threat is real. We have variants out there. Even though there's a vaccine on the horizon, we still are at great risk. And so what we've been doing this past year, and it will almost be a year soon, I think March 17th was the beginning of our, March 16th or 17th was the beginning of our shelter in place order. It seems like a lifetime ago. What we've been doing is still the same thing we need to do now. And it's all the more important now more than ever, particularly with the risk of variants, as well as with the vaccine on the horizon. So please be safe, and please continue to practice physical distancing. Please remember to wear a face covering when you're outside. Please limit your outdoor activity to those essential business that you have to do. Please don't have large gatherings with lots of people. You are allowed to have a pod of 3 households if you are outside. All this is critical to minimizing the spread of this virus and to keeping our community safe. So with that, I want to turn to our acting city manager, see if you have any closing comments for the Berkeley community.
Well, I want to thank you, Mr. Mayor, for hosting this town hall, and then for also your deep commitment to equity. I mean, that is one of the things that I'm most proud about working here in the city, is both being a part of a group of leaders and having a council and a mayor who are so deeply committed to equity that the passion really shows through in your voice when you spoke about that. And I know it is an absolute value of all of us on this panel. I can say, as the son of an African immigrant who has vision issues and is elderly, and there's no way she could sign up for getting COVID vaccine on her own, that Personally, I am also deeply committed to figuring out how do we help people like my mom get connected to this vaccine, who without some support from a local health jurisdiction like Berkeley really would most likely not be able to get the vaccine. So, and that thread is woven throughout all of our work, both in relation to the vaccine, but the whole pandemic response, and then all the work that we do in the city. So I'm just very much proud to be a part of that, appreciate your leadership on it, and appreciate the leadership of Drs. Varhus and Hernandez on that, as well as all city staff. It is just it's a shared commitment that we all have. And, also appreciate your reminding us that we need to stay vigilant. Really, I want to turn that over to the doctors to provide that message, but we hear you loud and clear, and I share it, but want to provide them an opportunity to say it. So thank you so much for the opportunity to be here with you tonight, and thank you to all the folks who joined us.
Thank you. I'm going to turn to the doctors now. Dr. Varhus, anything you'd like to share with the Berkeley community before we close?
Yeah, thank you, Mr. Mayor. Thanks everyone for listening in. I definitely want to echo what Mr. Budenhagen said around equity. I also just want to urge our community to recognize the challenging, emotional, and anxiety-filled situation that we are in right now. We have been sheltered in place for almost 11 months in a variety of ways. We are scared for our families, our community members. We have a lot of anxiety. We really want our kids back in school. We want to feel safe when we go to the grocery store. We want our seniors to know that we care about them and that they have a future with us. And there's so many, I get so many emails every day suggesting different ways of distributing the vaccine. And there's so many good arguments for why it should be one way or the other way. And at the end of the day, right now, we don't have enough vaccine. And so I just really want to encourage compassion for our community, compassion for our community members who are all having different experiences, and they all have different perspectives and ideas, and they are all valid. And I just want to collectively hold that diversity with some compassion. We will get through this, but compassion will get us through it better. So let's work on that collectively.
Thank you so very much. And last but certainly not least, Dr. Hernandez, anything you'd like to share with the Berkeley community before we close?
Well, I was queued up by Mr. Budenhagen to talk about the prevention messages. So I will say that and talk about exactly those things. At this time, we have to rely on what we know does work if we do them well, which is washing your hands, staying home when you're sick, physically distancing, and also wearing your face coverings. That said, I do want to also acknowledge the new initiative that you mentioned, Mr. Mayor, with an equity focus. And I am super excited about that and really helping us realize our equity value that I discussed in terms of our vaccine distribution, and really want to thank you for that. And end on that note with that hope that we are going to be able to continue our values and our focus with those in the community that have less access for one reason or the other. And I wish everyone a good night.
Thank you so much. Well, thank you, city leaders, for joining us today. As always, I know our community really appreciates this. I think this is very unique to have our public health officer and the city manager and the health director all here to answer questions directly from community members. It's deeply appreciated. And, just once again, please be safe, Berkeley. We're not out of it yet. Please be vigilant. Please remember to practice physical distancing and follow all the public health measures that we have been following to date, because it's really critical as we get through these next few weeks. So please stay tuned for